What do you do if someone's preferred language is not English?
I think we do a bit of a background sort of check about where they're sort of at, you know, if they have a level of English or if their preference is to use interpreters, and really try and avoid the use of family members because these discussions need to be translated accurately.
有啊，我经常都会看医生的时候，特别看一些专科医生都会使用翻译的，因为呢，家人不可能完全理解医生说的。
For communicating complicated, often very emotional issues, it really does help to have an interpreter. And even when they can understand the questions we're asking and respond simply, I find that having an interpreter in the room it might be only for every third or fourth question, can be very helpful.
因为中文学英文毕竟是一个语言的转变，还有就算是在这里出生长大的中国人，他的英文很好，但是他们的中文就不好。
By having an interpreter, I think the benefit there is that all parties can participate equally in that conversation. So I think it's extremely important that the healthcare provider can, give the necessary information that they need to give, but also, gather the necessary information. The patient, it's extremely important that they're able to speak in their own voice, that they don't have other people speaking for them. And then when we look at, family members that may be part of that conversational meeting, it's extremely important that they're also able to participate as a family member.
Quite often, I will come to the appointment and they'll say the children speak quite good English. And they say, oh, we don't need an interpreter. Why should we have an interpreter? I've always interpreted from my mother or my father. We don't need one. And I said, well, the health professional has booked me. I might as well just say, we can ask the health professional, does he want me to stay or does he want me to go? And usually the upshot of it is, no, you just stay just in case, we'll see how we go. And as it turns out, I sort of seem to get drawn into the conversations quite early on. And I end up doing all the interpreting, not the children. Afterwards, the response I get from the children was like, I'm so glad that you were here because I was able to ask my own questions that concerned me without having to worry about letting my parents, my father or my mother, understand what is going on. Because there were these things I wanted to ask. And the other interesting thing is, the information that you conveyed from the health professional, my parent totally differently accepted that than if I had been interpreting for them. So that's that one remove where you sort of got that more of that neutral where the parent can feel, and they respond as well, saying, I was able to ask my own questions.
My advice would be to explain to the family that the interpreters are part of the health system, that they are free to them, they are also professionals and who abide by confidentiality, and that the family members are very welcome to be part of the interview. They are very welcome to be there, to interact and to participate. In New South Wales Health, we have a policy, and it is a mandatory policy directive. It is called the Standard Procedures for Working with Healthcare Interpreters, and that policy clearly states that it is our responsibility to ensure that our patients have understanding and have participation in their healthcare. So that policy also states that where family members or patients maybe refuse an interpreter, the healthcare provider still has a responsibility but also a right to say, I need an interpreter.
There's a lot of facets to, the conversation, and we want to have the best possible communication with the patient, and that's what the interpreter really facilitates.
如果有翻译的话嘞，心里觉得很舒服，可以跟医生讲很多了解我想知道的东西。
When you're working with an interpreter, the interpreter is there to interpret the language, the spoken language. So the interpreter doesn't interpret the body language. The interpreter does not interpret the stress placed on words or the emotions. But because you are there as the healthcare professional, you're able to see that. Interpreters have to abide by an OSCET code of ethics. 3 tenets that are consistently important in these situations are accuracy, meaning that interpreters will interpret absolutely everything without adding or omitting any information, that they are neutral, they're impartial, they're not there to take anybody's side, and confidentiality.
Definitely face-to-face is the preference. It's not always possible. I suppose it also depends where you're at in the conversation, because advanced care planning doesn't normally just happen over one particular visit or one session. It's normally several. But in preference, especially if you were actually going to document down in a legal document, I think face-to-face is the best.
Face-to-face is definitely the preference for advanced care planning. These are topics usually that are quite sensitive. They bring about emotions.
For complex emotional issues, I find it much more helpful to have the interpreter in the room at the time.
Telephone is usually used for, as you said yourself, so whether it be emergency appointments where you may not be able to get somebody there straight away, where you're trying to organise an appointment, or where you just need to let the family know what it is that you're coming out for. When they are booking an interpreter, I mean, this often people don't realise the importance of this, but booking an interpreter to the service, they should be saying, we need an interpreter because we're going to be discussing advanced care planning with a patient and their family. It is a home visit. It is the very first time that we're meeting this family, and it's the first time that we're talking about developing advanced care planning and the wishes of the family. So that might be enough information for our staff then to be able to book an appropriate interpreter and to also give information to the interpreter and to say this is the topic area. The interpreter will then go away and they'll do some research. They'll look at what is advanced care planning if they don't have any information already. They'll think about the language that is being used and the terminology. They will start to anticipate the sort of questions, just knowing that this is a first-time visit.
What I also find helpful is actually having a conversation with the interpreter when they arrive, so they actually are fully aware of what the situation is, and obviously if there is any family conflict, that the interpreter is aware, so they're kind of not stuck in the middle, being unaware of actually what's happening around and really not knowing the agenda.
You introduce yourself, your role, and then you introduce the interpreter, because that will mean that interpreter is part of your team. So when you introduce the interpreter, then you will say the interpreter will interpret everything that we discuss. They will interpret in the first person. They are impartial. All information will be strictly confidential. If there is anything that you do not understand, so you would be saying this to the patient, please feel free to stop the conversation and ask me anything, and I'll be happy to explain, and the interpreter will interpret that.
I think the mistake that a lot of people make when using interpreters for the first time is they talk to the interpreter rather than to the patient. And the most important thing is to talk to the patient.
You'd be speaking directly to the patient's family, and you would have the interpreter interpreting using the first person. But the interpreter definitely relies on you to be looking at your patient, paying attention to their facial expressions, paying attention to their body language to determine whether they're becoming uncomfortable, whether they're becoming stressed, or whether they're not understanding. Another thing that's really important, because the interpreter will be interpreting it using a consecutive mode. The consecutive mode means that you or the patient or your client will speak. You speak a number of sentences, 2, 3, 4, 5 sentences, each sentence containing an idea. Then you stop and the interpreter then interprets. So it's also important to pace the conversation and to stop frequently, allowing the interpreter enough time to interpret.
You have to allow time for the interpreter to explain things to the patient, because sometimes what seems a straightforward question in English requires a bit of a conversation between the interpreter and the patient, so you have to allow them time to carry it on. I do like the interpreter to tell me what the patient's saying, not just the final answer, but all along the way. And sometimes you have to prompt interpreters to say, well, you know, what are they saying? You know, because sometimes there's a whole dialogue going on between the interpreter and the patient. They only tell you the last sentence.
One interpreter told me once that there's no such word for resuscitation in their language. You would be saying, I want to reawaken this person, like they've been asleep. So the patient, there was no word for around, you know, resuscitation, or that she didn't want to be resuscitated. How do we phrase that?
There are, in many languages, there is some vocabulary that may not be transferable. And so it's really important that people are able to have a conversation with you and say, I don't know how to interpret that.
But the most important thing for me as an interpreter for a good conversation to happen is for the health professional to have control over the whole meeting. Like an MC, I would call it, who has control over that discussion and would clearly lay out, this is what we are going to be talking about. We have an interpreter present, and I would like people to take turns, not to speak all at once, so that everybody can understand exactly what is going on. And I find it sort of also calms down the situation, because they have to take turns. They can't be too emotional. They have to let the other person finish. It sort of brings down the emotional content of the conversation to a manageable level, because it can be very, very difficult, especially if there are conflicting opinions within the family about what the future care should be.
After the interview itself, I think it's also important to debrief with the interpreter. Advanced care planning and talking about some of these issues can bring up emotions for an interpreter that they may have had to deal with within their own personal situation.
Sometimes I've also seen the interpreter get upset about having the conversation, because some people are definitely not comfortable talking about death. And so it can be that the family and the patient are happy to talk about the care at the end of life, but the interpreter is alarmed about it or uncomfortable with it.
Set up the room so you are looking directly at your client.
So that I plan to sit here.
The interpreter should sit to the side and just behind them.
This lady's been referred to me for advanced care planning. Do you know a lot about advanced care?
The interpreter can interpret more accurately if they have a clear understanding of the purpose of your meeting.
And if there's anything that I say, I'll bring her in.
Do you want to take a seat?
Explain who is present and what will happen.
My name's Anne, I'm a nurse from the hospital, and this is Jane. Jane will be interpreting for you today.
Introduce the interpreter and explain they are part of the healthcare team, they are health professionals who abide by their own code of ethics, and all information they interpret is confidential. Speak to the client, not the interpreter, and maintain culturally appropriate eye contact with them, even when the interpreter is interpreting. When speaking or listening, watch the client rather than the interpreter, so non-verbal messages can be observed. Staying focused on your patient will help to build rapport.
If I can explain a little bit, advanced care planning is thinking about the sort of future care.
Remember to speak normally and to allow time for the interpreter to interpret.
那么刚说的这个提前护理计划是未来的事情了。
Make sure you check your client understands you.
Great, this is good.
我也没想过，那应该是我的丈夫吧。
I haven't thought about it clearly.
The person who's closest to us might be a bit hard.
Now I understand it a bit better.
It is good practice to have a short follow-up discussion with the interpreter afterwards to discuss how the exchange went. This may also help the interpreter if it was a difficult or emotional exchange.
And that has information in it.
Using professional interpreters is important. They make it possible for your client to speak in their own voice about their future healthcare wishes.
Thank you.